We are going to discuss basic limb synergies. Mass movement patterns in response to stimulus or voluntary effort. They can be flexor, extensor, and mixed. Flexor synergies of upper extremity. We'll discuss the pattern of movement and the pattern of spastic state on these bones or these joints, etc. Scapula. What are the pattern of scapula? It will be in retraction. And what will be the pattern of shoulder? It will be in elevation, abduction, external rotation. On elbow it will be flexion to acute angle. Forearm will be in supination. Wrist and finger variable, most commonly flexed. Now you have to remember what are the strongest and what are the weakest components of flexor synergies of upper extremities. In flexor synergy of upper extremity, the strongest component is elbow flexion and shoulder elevation and retraction, while the weakest component was shoulder abduction and external rotation. You can make mnemonics of these two, keep them remember in your mind. The next thing is extensor synergies of upper limb. On scapula there is protection, shoulder adduction and internal rotation, elbow extension, forearm pronation, wrist and finger variable. Strongest component internal rotation, adduction and pronation, and the weakest component is elbow extension. What is the mixed synergy of upper limb? It is a combination of strong component of both synergy. The easy way to keep it remember is to make mnemonics. Now flexor synergies of lower limb. Hip flexion, abduction, external rotation, knee flexion to about 90 degree, just like elbow was at acute angle. In upper limb here, the knee is flexion to about 90 degree. Ankle dorsiflexion and inversion, toes extension, strongest component hip flexion, weakest component hip abduction, external rotation. Extensor synergies of lower limb, hip extension, knee extension, ankle. Obviously plantar flexion and inversion as it will reverse. Toes plantar flexion. Strongest component is hip adduction and knee extension. Weakest is hip internal rotation. And in mixed synergies, it is a combination of both. Evaluation is done to select the treatment pattern and check the prognosis of the condition. It includes determination of the following. So in this video, we just discussed about the synergies that are flexor synergies and extensor synergies as well, and a combination of both that we call mixed synergy. The thing is, how can we remember it, as they seem little bit tricky, so you should make mnemonics for your own ease to keep them remember. So this can helpful for you. I hope this video will help you in learning your synergic patterns. That's all about. Thank you. For your own ease, you can have pictures such like this, and so you can get an idea about the muscle and joint arrangement or the pattern your body is having, or your extremity either upper or lower. So you can concentrate on picture, and then it will be helpful for you to keep the synergic pattern remembered in your mind. Thank you.